Okay, so we just wanted to give you an idea of what this looks like in supine. And just to kind of clarify what we're doing again, in client stat that typically express limitations in knee flexion. Again, very often they might be biasing more of an externally rotated behavior of the tibia. So we're essentially trying to unload the screw home mechanism. So when that client moves through knee extension, they start to approach 20 to 30 degrees short of knee extension, and that tibia starts to externally rotate. That's the screw home mechanism. And so we need to unload that screw home mechanism to kickstart that tibial internal rotation. That's why we like to start kind of just beyond 20 to 30 degrees of knee flexion. But this is just to give you an idea of how it might look to approach the end range a little bit more, so which is difficult in sitting on the edge of the table. But typically what we'll do is a very similar strategy. It just doesn't give us the capacity to distract the tibiofemoral joint like we can when we're sitting on the edge. But we'll still cradle the calcaneus in my hand. So we'll move to the point of the barrier. Let's say the barrier is right here, and she can't flex anymore. Let's say she kind of feels a tension build up across the anterior portion of the knee, which is common in clients that can't allow for that dissociation between the femur and the tibia. We'll come just short of that, bring the ankle into mid-range and apply the same directional loading, so building tension into the hand. And then typically when it comes to moving into the end range, we find it's very difficult for the client to express more eccentric capacities. And that's normal, because typically when they're doing that, it might be too much of a challenge for them to express that when we're moving in towards the end range of motion. Because remember, when it comes to moving towards, when we're looking at this interaction between the femur and the tibia here, and we kind of compare it to what we're doing with the femur and the pelvis, to be specific to the directional range of motion that we're trying to improve, we were still loading the biarticular tissues, but we were changing the internal rotation, external rotation movement of the femur. Here, once we get into the next few strategies, it's very, very similar, but we're changing the position of the knee now. So it's knee flexion. If we're trying to improve knee flexion, we need to move towards knee flexion. If we're trying to improve knee extension, we need to move towards knee extension. But we're considering the biarticular tissues, we're considering the rotational component of the joints to allow for that sagittal plane range of motion to knee flexion and knee extension. So same thing again, so hold that position. Ideally the client can maintain there. Again, sometimes, again, the reason why we will do it in sitting is because it actually gives the femur the capacity to stay stabilized in contact with the table. So if a client is struggling to maintain stability of the femur in a supine position, we might have to do it in a seated position. You just might need to make sure you have space underneath the table to allow for that flexed knee or allow for that tibia to flex underneath the table. It can be a bit difficult to do, but it's a bit easier to keep the femur stabilized there on the table. Here, sometimes you might have clients that have difficulty. So holding that position again, we'll have Rachel slowly build tension as if she's twisting the foot internally or towards the camera. So build that tension in my hand, keep pushing, just keep it nice and gentle. Good. And keep pushing, but keep it very, very gentle. Good. 45 seconds, and then we can build a little bit further in and build tension again, and just keep approaching that end range, right? But we need to recognize that, again, this is just driving low through the tibia. We might need to incorporate some strategies to load the biarticular tissues as well, and that's what we're going to go through in the next few strategies. We're going to show you a different kind of strategy that we can use in sitting as well, but here we just wanted to show you how it might look when we're trying to approach that barrier a little bit more.